gonna wash my hands. Hi, Mr. Arns. I'm gonna be your student nurse today. My name is Shannon Carlson. Can you please state your name and date of birth for me? And then his name is David Arns. His date of birth is 3/24/1947. And I looked at his wristband, and he also has a fall risk and an allergy band on. And then I'm gonna assess his room for any safety precautions. His bed is locked. He has an IV pole on the ground, but not hooked up to him, so I'd pick that up. And then I'm gonna check his skin now. I'm going to ask him some more questions of level of consciousness. I'm going to be like, do you understand where you are today? And then he'd respond and make sure he's alert and oriented ×4. And then I'm going to assess his skin for any sweating, make sure his eyes are reactive. And then his skin is all dry and warm. Then I'm going to move to the chest. I'm going to look for any lesions, bruising, make sure there's no discoloration. Then I'm going to palpate, and his chest is symmetrical. Then I'm going to listen. I'm going to listen to his breathing at all 6 spots. Also on here, I'm going to listen to the heart rate. Make sure his lungs are clear, bilateral. And then I'm going to ask for temperature, O2 sat, and then take his blood pressure. Then I'm going to check for cap refill. And it's less than 3 seconds. I'm going to have him squeeze my hands bilaterally, and then take his pulses bilaterally. And I'm going to move down to the GI. And first I'm going to look at it, then I'm going to listen, then palpate. And I would listen for 5 minutes in all 4 quadrants. I would also ask him if he is passing any gas, or if he has passed any gas recently. Then I'm going to move down. Look at his peri area and make sure everything is normal. No bumps or bruises or anything like that. Make sure he doesn't have a catheter in, or if he does have a catheter in, ask him if it's causing any pain and check how much urine is in it. And then I'm going to feel his legs. Make sure they're warm to touch and cool. Then I'm going to have him check cap refill of his feet, have him push against me, check for strength, do it on both feet. Feel for pedal pulses as well. And I'm also going to have him sit up and listen to his back. And I'll do the zigzag pattern on his back as well, listening to his lungs. I'm also going to make sure he has his call light and ask him if there's anything else he needs from me.